Hi, I'm Shelley Weber Tompkins, a certified functional medicine practitioner and integrative practitioner. So, today I really wanted to talk to you about the impact that inflammation can have on fertility. And it's one of those areas that probably isn't talked about enough, but with inflammation, it's one of those ones that you may not even realize you have. You don't know that that may be a factor that is impacting whether you're getting pregnant or not, or staying pregnant. And so, normally, inflammation is actually a healthy thing. It tells us when we have an injury, and we need to know that, so we're taking care of it. And so the other thing, though, that it can do is when there's too much inflammation going on internally, it can impact our fertility and actually cause problems with sperm if it's in the male, and it can definitely cause problems with being able to implant and have a baby. And so inflammation is definitely a factor that can affect a lot of the processes going into trying to conceive, but we don't always know we have it. And so there's some symptoms and stuff that may come up over and over again that you don't even realize are inflammation based. And so that's kind of what I'm going to look at right now. With women, it could make it difficult for fertilizing an egg too, if I didn't already mention that. But some of the conditions that are inflammatory based are things like endometriosis, fibroids, adenomyosis, and the ones that I just mentioned, some people don't even know they have it. With endometriosis, typically pain is a factor, but that's for the ratio has always been like 97% of people usually have pain with endometriosis, but then there's that 3% that may not notice it. But the other thing about endometriosis is it can be very pervasive throughout the intestinal area. And so if you have any implants or endometrial tissue that clings to your GI tract, then you can start getting pain there. And a lot of times people confuse gastrointestinal symptoms alone with that's all that's going on. Like they have celiac or they have inflammatory bowel disorder, which those symptoms can definitely come up when you have endometriosis, but you may not be putting those two things together. And so if you do have those kinds of inflammatory factors happening, then having a little deeper look, because having endometriosis, adenomyosis, fibroids, any of those can definitely cause problems when you're trying to conceive. If it's, more of the strong pain factors and inflammation that goes on with endometriosis, then it depends on where it's clinging to. If it's on your fallopian tubes, or if it's connected on your uterus, or if there's any number of places that lesions and stuff can actually cling to and cause inflammation and therefore pain, especially when they're close to nerve tissue. And fibroids don't always cause pain. Sometimes you don't even know they're there, but they can cause problems with having a baby, or trying to get pregnant in the first place. If you're having the fibroid is causing you to lose more blood with your period, or if they are taking up space in the uterus, like where they're actually attached. They can be in the muscular tissue, they can be in the outside area of it. But when they're attached to the uterus, then any blood flow that's going through the arteries to that area can be impacted, because it's going to start using those to feed itself versus you feeding a baby. And so knowing about inflammation, but also having enough ultrasounds or internal checks just to make sure if you have some of those symptoms of pain, or if you've had a longer time trying to conceive, then making sure that you're seeing your doctor and you're getting those tests done. So sometimes it's an ultrasound, but when it does come to, unfortunately, with endometriosis, it can be harder to find sometimes, unless it's very pervasive, then they may see it a little bit more readily. But it can be a chameleon in hiding. And so if you know you have pain symptoms, definitely having that checked into. But even if you're not sure, they couldn't find it, working more on anti-inflammatory factors in your lifestyle and in your diet can really help a lot with minimizing your symptoms and being able to help your reproductive path. So that's what I'm going to talk about. Since having that inflammation can make your blood thicker, we want to make sure that we're doing things to help lessen inflammation, so that blood moves into areas more readily and easily to be able to feed an embryo trying to grow there. And so I would say that that's important for every woman to be considering, especially like if they do any blood tests and they see that they have higher fibrinogen, which is clotting factor, or if their blood platelets are high, or I mean, there's different tests and stuff that will show if there's inflammation present, even doing the blood markers for, the neutrophils. It's usually a CBC with differential. It will tell more about the inflammatory factors. And your doctor's going to be the one that should be looking at that and telling you. I don't expect you to know all this stuff on your own. But if you're seeing that you have more pain or your blood is thicker and more easily clotted when you pass it with your periods, that's something to note. It can disrupt your hormone balance too when you have more inflammation, and that can also impact your ovulation. And so we want to look at that. Some of the things that you can do to work on, as I was saying, like dietarily, is making sure that you're taking in organic fruits and vegetables as much as possible. You can look at the Environmental Working Group, EWG, and they every year will put out a new list of what foods are better for you to take in organic versus non-organic, because the ones that are really highest in pesticide spraying are the ones you want to avoid unless you're getting them organic, because at least you're going to lessen that all the pesticides and their impact on inflammation internally. And so you're avoiding those. You're trying to stay out of, like, when there's more and more problems with the air quality, you want to make sure you're masking up or covering up or not going out in it and breathing that in. Just being mindful. I always look at my phone to check what that is per day. So sometimes you don't even, we think if we don't see it, it's not there, but it is. So if they're out there spraying today for pesticides, don't go out in that area where they are. Make sure you're eating good foods and that you're taking in supplementing even with some things that are anti-inflammatory. But there are things you can get in your diet. So I was going to say getting in more colorful foods and vegetables. And like I said, check the list, because it will tell you the clean 15 are the ones that are not so impacted by pesticides, whereas the dirty dozen are. So you always want to be kind of looking at that and going, okay, so those I'll definitely get organic. The rest of them, I can probably get away with not having them that way. Your fatty fish like salmon, sardines, mackerel, those are higher in your omega-3s. And so when you're trying to diminish your inflammation, those are foods you could add a little bit more of to your diet and have that help. The other things would be even like really good quality olive oil is helpful. And if you're having grains, and you've been tested and you know which ones you're okay with eating, then your whole grains, they can be okay for you. If you know you have sensitivities in the bowel, you may want to avoid wheat products, and which also goes into, it's like gluten-y products. They can be really heavily sprayed with pesticides when they're in the field. So I usually tell people try and limit those unless you're getting like a sourdough that's clean sourdough, that's been definitely gone through the process longer for helping to clear out glutens in there. And maybe they're using organic grains as well, which would be another plus. So I get it, when people love bread, it's really hard to give that up. So that's something that can be done. Drinking more purified water, getting that in to clear things out. Green tea, again, organic. There's other teas and stuff that you can have as well, but I would say trying to organic, avoid caffeine as much as possible. Okay. So I talked about the foods that you can add that can be helpful for diminishing inflammation, but now I'm going to mention some things that you want to avoid that do cause inflammation, and that's your sugary drinks and snacks, your processed meats, and so anything that's, unfortunately, sorry, bacon, sausages, things of that nature, and your bologna, anything that you're eating on that meat aisle that's already packaged up like that. Those processed meats usually are full of all kinds of things that are not so helpful when you're trying to diminish inflammation. So avoid those. Fried foods are another one, fried in the oils over and over again. If you have control of things, you can always do air fryer stuff and make them yourself. And that way you're not going to be getting those rancid oils into your food. So that's the idea there is they are inflammatory, so avoid that. Too much red meat can also be a problem, especially if you're getting the ones that are hormone meats. If you're getting grass-fed, grass-finished, then you're going to have a better chance of having something that's not going to be so contributing to inflammation. The other thing is excessive alcohol. I would say if you're trying to get pregnant, to eliminate that altogether. If you have any a little bit of red wine or something, as long as it's not one that's high tannins and that type of thing, where if you get headaches from it, you're probably not drinking it anyway. So those are things to be mindful of, is eating better foods and lessening the ones that contribute to it, and also looking at the environmental factors and making sure that you're taking steps to keep your system clean and away from some of those environmental toxins. And otherwise, I think just making changes every day in your diet to try and minimize things, because I know it's hard to do it, to cut everything off all at one time. But if you start being mindful about things you're buying at the grocery store, the produce that you're taking in, and some of those, I'll even suggest like getting organic frozen products, because you can keep those in the freezer for a bit and then have them on hand. So when you're trying to eat better and more healthy, it's not the constant trips to the store, but you can actually have something more readily available. If you do have any questions about any of these things and want to know more about how inflammation could be affecting you personally, please direct message me and I'd be happy to answer any questions that you have. Okay, make it a great day.